Hi folks, it's Dr. Craig Steingraber. I'm here today to talk about chronic back pain relief. Now really it can be called chronic pain relief, and want to break that down, the different components of that over the next few weeks. And I promise I'm going to be better at getting these videos out there. And that's a promise to Patrick. So here we go. What we really have to do is we have to have a positive effect on the peripheral, central, autonomic, and potentially the enteric nervous systems. Now, of course, as far as the production of pain, we don't want any infections, we don't want fractures, we don't want tumors. It has to be a non-surgical fix, so to speak. If we've had previous surgeries or have arthritides, different types of arthritises is the proper terminology, and other aspects of health conditions, you say, well, that's why I have pain. Well, that's all well and good, but we have to find the right clinicians that are able to evaluate how we can have a positive effect on these nervous systems. Okay. Now, in the past, we've talked about increasing flexibility and strength of muscles, tendons, and ligaments, and how that can impact pain relief. We're going to go through that again and in different ways to define the different components of why that's important and how to do that, because that certainly can have a component in decreasing or having a positive effect on the nervous system. We've got to decrease physical strain and stress and strain and stress and strain. Now, there's many ways to do that. We'll comment on those different components, the common components that have to do with that. Improving body chemistry. That's a huge subject. Probably almost infinitely more things to talk about than it is for these two things. But this is something that's very commonly, well, I don't know if overlooked is the right way, or right thing to say, but I'll use that term for now. Once again, it's finding the clinicians that have the postgraduate study to evaluate these various systems and to apply the different types of therapeutics and suggestions to address these components. And we're going to go through that here as the weeks go on. Thanks for joining me. We'll see you next week.